Pharmaceutical Association of Kenya is calling on President Uhuru Kenyatta to personally interfere to end the doctors' strike. Led by its president, Dr. Mwaniki, the society says they will stop supplying pharmaceutical products if the strike is not resolved by the 3rd of January, which is just a few days from now. Now, Mwaniki has accused the president and his government of being insensitive to the plight of doctors and Kenyans suffering as the result of the strike.
There should be procedures on recruitment, promotion, transfer, resignation, and termination. There should be policies on training, internship, career development, research, better working conditions for doctors in the public sector, including namely having facilities that are well equipped with drugs and medical supplies, housing, transport, security for doctors, call room, enough support staff, work within hours mandated by law, and compensation for overtime, staff housing, and assured transport security for doctors on call. All those are things to ensure these health workers, the doctors, when you put them there, that they have the necessary capacity, including commodities and support staff, to be able to perform their functions, including equipment. There should be employee benefits, health insurance, retirement benefit, mortgage, car loan. What we are saying is that the president of this country so far has not said anything significant about this strike. In my own opinion, I think the people who are advising the president, they are misleading him. They are telling him that things are okay, that the patients maybe who are always seen in Kenyatta National Hospital, all the other public facilities, sharing beds, very sick, being attended to doctors when they are at work, that those patients, they are most probably at home enjoying nyama choma, enjoying drinks, and that everything is okay. In my own opinion, that is misleading the head of state, and if the head of state should consult even people like us, we give them the reality of what is happening. People are dying at home, people are dying in large numbers. Mothers who are supposed to deliver in hospitals, they are delivering at home. And if any complaint which arise, which sometimes 60% arise, the only people who are allowed to do cesarean surgery to actually help those mothers and save them from the death are the doctors who are on strike. There are people who are out there and they are supposed to go to the hospitals to pick their drugs for TB, to pick their drugs for HIV, after even other tests. Today, the people who are supposed to be consuming anti-TB drugs, they are not getting that supply. That means we have a risk of getting drug-resistant TB or drug-resistant TB due to this kind of shortcomings, and this is a great health risk to this country. Patients who are supposed to be on ARVs, they are not supposed to miss even a single day on the supply of those products. The ARVs are distributed free of charge in public facilities. Private facilities don't distribute ARVs. So the thousands of people who are supposed to be on ARV and they're supposed to be collecting them regularly from public facilities, right now they are not taking them because they don't have those drugs.
All right, let's now speak to our reporter, Mark Namaswa, who now joins us from our City Center studios with an update of what exactly this particular decision by the Pharmaceutical Board would mean for the doctors' strike. A very good afternoon to you, Mark. Looking at the situation, the strike is almost entering its 3rd week now. What will this mean for patients in all public hospitals if the pharmacists make good their threat?
Akisa, this is part of what can be interpreted as a momentum-building process within the medical fraternity. Remember yesterday we had doctors from private hospitals announcing that they are officially joining the strike, which began yesterday with them starting to strike every Thursday of the week until this stalemate is resolved. But now the entry of the Pharmaceutical Society of Kenya means that the momentum building process within the medical fraternity to force the government into giving in to their demands, or at least addressing some of their grievances, seems to be coming up. And this is an interpretation of the situation getting worse, especially in terms of attendance to patients and medical dispensation of drugs across the country. Akisa.
Now, looking at the situation currently, and of course, as you mentioned, private doctors, consultants, and now pharmacists have joined in this particular call for the government to give in to the demands of the doctors. Are we likely to get any communication from the Ministry of Health?
What has been happening, if we look back at the trends that have been happening over the past 19 days of the strike, is that whenever medical practitioners hold a demonstration or call the government to action, we are usually called at around 6 p.m. going to 7 p.m. by government officials who will be answering back what medical practitioners have said. But we expect them to say something. Remember today, the president of the Pharmaceutical Society of Kenya, Paul, called out to the president to make a decisive statement concerning the stalemate in the medical industry. He called on the president to say something substantial, and he said the president was probably not very serious about the entire issue. But if we start to count what the implication of the entry of the Pharmaceutical Society of Kenya is to the entire strike issue, is that apart from pharmacists being part of KMPDU that has been at the forefront of the strike conducted by doctors, we see the entry of the Pharmaceutical Society also bringing in other players in the medical supplies chain. For instance, manufacturers, importers, and suppliers of drugs, and also dispensers across the country are members of the Pharmaceutical Society of Kenya. And with the institution calling their members to officially begin striking or not rendering their services to the public starting from January next year, it means that the entire industry, both the pharmaceutical industry and also the healthcare service delivery industry, might be paralyzed if this stalemate is not resolved in good time. Akisa.
Well, it's definitely